Flashcard 60's answer is placebo, an inactive substance with no therapeutic effect. It is used in clinical trials for comparison and to help determine if effects are medication-related or psychological. Flashcard 61 asks, what is the half-life of a drug and how is it used in dosing? The half-life of a drug is the time it takes for a 50% reduction of the drug's concentration. It determines dosing frequency, as drugs with a short half-life need frequent dosing. It takes 4 to 5 half-lives to reach a steady state or to be eliminated. Flashcard 62 asks, what is steady-state concentration and how many half-lives does it take to reach? Steady state is reached when the drug input equals the drug elimination, maintaining consistent drug levels. It is typically reached after 4 to 5 half-lives of regular dosing and is important for medications requiring therapeutic levels, such as antibiotics and anticonvulsants. Flashcard 63 asks, what does contraindication mean and give an example? A contraindication is a reason not to use a drug due to a risk of harm. An example is ACE inhibitors during pregnancy due to fetal harm. An absolute contraindication means never use due to high risk. A relative contraindication means use with caution, as benefits may outweigh risks. Flashcard 64 asks, what is an adverse drug reaction, ADR, and how is it different from a side effect? An ADR is an unintended harmful reaction at normal doses that is usually serious and may require medical intervention. A side effect is a predictable, often mild effect like drowsiness. All ADRs are side effects, but not vice versa. Flashcard 65 asks, what is the meaning of Qs on a prescription or compounding formula? Qs stands for quantum sufficit, meaning quantity sufficient. It instructs to add enough of a substance to reach the final desired volume or weight. It is used in compounding when the exact amount depends on other ingredients. Flashcard 66 asks, what is expiration date versus beyond use date, BUD? The expiration date is the manufacturer's guarantee of potency and sterility on an unopened container. The beyond use date, BUD, is the date after opening or reconstituting when the medication should be discarded. BUD is typically shorter. Flashcard 67 asks, what is lot number and why is it important? The lot number is a unique identifier assigned by the manufacturer to a specific batch of medication. It is critical for recalls, quality control, and tracking. It must be recorded when dispensing, especially for vaccines and injectables. Flashcard 68 asks, what is the difference between generic substitution and therapeutic substitution? Generic substitution involves using the same active ingredient from a different manufacturer and is acceptable unless dispense as written is indicated. Therapeutic substitution involves a different drug in the same class with a similar effect and requires prescriber approval. Flashcard 69 asks, what is prior authorization, PA, and when is it required? Prior authorization, or PA, is an insurance requirement for approval before covering expensive or non-preferred drugs. The prescriber must submit paperwork justifying the medical need. The patient may pay the full price or wait for approval, as the process can take days. Flashcard 70 asks, what is therapeutic equivalence and how is it determined?